interaction with outside environment is vital in normal development of growing children. But the question is, how safe is my child when he goes outside to play? I am here to discuss about one of our most valuable assets, our children. It's widely spoken that the first wave affected elderly, the second wave affected middle age, and is the third wave going to affect kids? Today I am going to discuss about 5 important scientific reasons why kids react differently to COVID as compared to adults. Why do children react differently to COVID? Reason number 1. Children are already exposed to variants of coronavirus which causes common cold, and because of which their immune system is already primed to provide them with some protection against COVID-19. This activation of adaptive immunity to common coronavirus is seen typically in children below 14 years of age. The second reason why children react differently to COVID, the lack of ACE2 receptors. COVID needs a receptor to enter into the human body. The lack of receptors in children makes it difficult for the virus to enter into the body. Also, there is reduced TMPRSS2, which is transmembrane serine protease 2. This helps in replication of the virus, and reduced protein of this kind in children makes it difficult for the virus to replicate in the lungs. Protective T2 immunity in children. There is T1 immunity and T2 immunity. The T1 immunity is the one which produces inflammatory cells. It is pro-inflammatory and this attacks the virus. The T2 is anti-inflammatory. It just nullifies the T1 and neutralizes the inflammation. Too much of inflammation causes tissue damage. So there should be a fine balance between T1 and T2, which is much better in kids as compared to adults. Reason number 4 why children react different to COVID as compared to adults. Children produce low level of inflammatory cytokines. What do you mean by that? You heard of this terminology called cytokine storm. That means there is a surge of release of cytokines to attack the virus when it enters into the human system. But these cytokines can also attack our normal cells in the body, which causes post-COVID complications. So this response is much better in children as compared to adults. The last but not the least, the 5th reason why the kids react differently to COVID. The eosinophils in children secondary to allergies or secondary to asthma also helps in protection of children against COVID. So these are the 5 reasons why children are less affected as compared to adults because of COVID. This information will hopefully provide a sense of reassurance and a sense of relief, but this is not a free pass.